Hi, my name is Emily, and today we're going to be doing the central line dressing change. So this is my station. I'm going to be at this level so you can see everything. So before we get started, I'm just going to check my orders. I have it on my laptop in front of me because my printer broke, so I couldn't print them out. So they're at the front in front of me. I'm going to check my name. So we have our patient Wanda Chi, MRN 87292301, date of birth 09/20/19XX, no known allergies. The physician orders are maintain central line placement at 0800, central line sterile dressing change Q7 days and PRN at 0800. Notify MD for any signs of infection, redness, tenderness, swelling, purulent, or foul smelling drainage at 0800. So that's what we're gonna do. Oh my God, I'm out of breath. Okay, so once we've done that, we're gonna go to our patient's room, introduce ourselves, and just ask the patient for their name and date of birth. So here we go. Knock, knock, knock. Hi, my name's Emily. I'm gonna be your nurse today. Can you tell me your name and your date of birth? Patient state's name is Wanda Chi, date of birth 09/20/19XX. Do you have any allergies? No. Okay, so we're just gonna tell her what we're gonna do. We're gonna change the central line dressing. Do you have any questions? No. Okay, you tell her that you're doing it to prevent infection and you have to change it every Q7 days from the date that it says on the dressing. So, okay, perfect. She has no questions. You provide privacy. Make sure that the bed is at a good level so you don't hurt your back. Make sure the bed rolls are down and you're good to go. That you have your equipment where you need to be on a sterile surface. Okay, so we're gonna wash our hands and we're gonna put on our gloves. Okay, perfect. So basically first, here is our central line. Okay, this is taped down, sterile. Our Cural's cap would be on the tip of that, by the way. So we're gonna check for the appearance, any redness, tenderness, ask the patient if they feel a bit hot around the area. Patient says no. So no edema, nothing, it looks perfect. So it looks good. So now we're gonna measure, our equipment. Sorry, we're gonna leave off of that. So we have our central line, our ruler. Sorry, I lost mine, so I just made one. Dressing change tray, and our bio patch. Okay, perfect. Gloves, and then we have a little trash can over here. Okay, so to where I left off. So it looks good. Now we're gonna measure the length of the exposed catheter, the insertion site all the way to the tip. So the reason you do this is because you want to make sure that the nurse before you and you have the same documentation. So I got 7. So I'm going to just assure that it matches the previous documentation by the other nurse. So after that, we're good to go. Everything's good. So now we can move on. Now we're going to open our sterile kit. We're just going to make sure that the whole top is off because, there we go. Okay. So after that, we're going to just take the whole top piece off. And what is that? We're going to open it using the tips of our fingers because it's like this. Maintaining sterile technique. We're just going to use the tips. Barely touching it. You're just going to fold it out like that. So it's going to be perfectly folded out. Okay, so there it is. You barely touched it. So what I'm going to do is I'm just going to get my face mask. And I'm going to have my face mask on before anything, just because there is a risk of infection. So you're going to just put your face mask on like this. Okay. The risk of bacterial infection, just because, droplets coming from your mouth, so you don't want to do that. You're going to ask Miss Chi to turn her head away, and you're going to put your face mask on before anything. So now we're going to have to remove our tegaderm, and what we're going to do is just remove it long ways. So here I am removing my tegaderm. We're holding down the bio patch first, holding it down just so we don't tear it off. You don't want to abruptly tear it off. Okay, so we're just going to softly just take it off. Okay, here we go. So now everything's there. Checking for drainage on the bio patch, no drainage. Always want to make sure. So then we're going to wrap that in our gloves as I'm doing so. Okay, and we're going to throw in our little trash. Throw away. Okay, now I'm going to wash my hands. Okay, we're going to take out our sterile gloves. So I'm just going to put that over there. Okay, so we're going to put to the side. Okay, and then we have our bio patch. So we're just going to throw that. We're going to open it. And before we put our sterile gloves on, oh, I'm having some trouble opening this. Sorry. Okay. There we go. Now we're cooking. Okay. So we're just going to throw that in there. Okay, so throw. Okay. It's in there. All right. Trash. All right. So we're just going to, we let it fall into the sterile field. We're now going to make sure our hands are washed, and we're going to apply our sterile gloves. So we have our left and our right. All right. So we're just going to open this up. Without breaking sterile technique, we put on our gloves. Okay. All right. Not breaking sterile technique. We put on our gloves, making sure we put them on correctly. These are a little weird, but okay. So now we're ready. We have our sterile gloves. We did not break sterile technique. So we're in a sterile area. Let me move this aside. Sorry, not breaking sterile technique, not breaking sterile technique. Just making sure you can see. Okay. So we're going to get our chlorhexidine. We have one clean hand, one dirty hand. The dirty hand, we're going to be grabbing the catheter. The clean hand, we're going to be grabbing the things from the sterile field. Okay, so my left would be my clean hand. My right would be my dirty hand. Okay, so now we're just going to use a chlorhexidine. And we're going to activate it by pressing the sides, but we're not going to really activate it. So we're just going to be going back and forth. Not back and forth. We're going to, the clean hand, going to hold the catheter. And then with the, no, dirty hand's going to hold the catheter. Clean hand will go back and forth motion over the site. We're going to clean for 30 seconds. So, we clean for 30 seconds. Okay, perfect. So sorry, I had to burp. All right, so then that's it. So we cleaned it, throw that away. Clean hand grabs the bio patch. There's a little slit right there. So you're just gonna apply that over. Perfect. Clean hand, okay? So you're gonna put the blue side up. Blue faces the sky, white will be down. So I use my clean hand for the bio patch. You're gonna slide it on there. Now, to apply the tegaderm, I'm gonna grab it with my clean hand, but we're gonna use both hands. Okay, so now we're gonna get with both hands. And don't touch that little window because that part is sterile. We're gonna place it over, make sure it's good. The insertion site's not super blocked. Okay. Okay, then the sterile part's over when you can use both hands. So we're gonna just take this one part off. Okay, perfect. It's on there. So then now you have your tegaderm. The sterile part is over. Then we just take this outer part off that we did. We're gonna put our label on it, initial, name, initial, date, and time, just the way so when you change, it's time to change the dressing, you know. You're not gonna put it over the insertion site. Try to put it on the side. Okay, and then date and initial it. Perfect. You have everything that you need. So we cleaned up the area, we changed the dressing site, we maintained sterile technique. And when we maintained the sterile technique, we made sure to hold it up and clean it very thoroughly. We applied the biopatch, then put the tegaderm on. We put our mask on before taking the dressing off, very important. Then we dropped the biopatch over the sterile gloves as you saw me do. And now we verbalized everything, okay? So after that, we're just gonna clean up our area. We're gonna dispose of everything in the trash. Okay. Everything is getting disposed of. Here we have clean. Everything's good. So dispose of equipment. We put the patient's side rolls up, bed in low position, call light in reach. Patient's belongings are within their reach. We're gonna make sure that we performed hand hygiene. So I'm going to take off my gloves. I'm going to dispose of them. Okay, hand hygiene. Okay, bed in low position. Everything's good. We washed hands. All right, so make sure call light, bed alarm, bed low position, bed rolls up. We are good. So we're also going to document everything, making sure our site is initial time and documented. Everything's good. We documented everything, so we're good to go. So I have watched the central blood draw video, central line blood draw video. So yes, that will be also part of this skill as well. Yes, thank you very much. Bye.